Cape Cod Broadcasting weaves the listening environments of 99.9 WQRC, Ocean 104.7, WFCC Classical 107.5, Cape Country 104, and CapeCon.com's website experience to reflect the lifestyles of the people who live, work, and play on Cape Cod. We hope that you enjoy this podcast.
I'm Laura Reckford, and this is Sunday Journal. I'm here in the studio with Cheryl Bartlett, who recently completed service as Commissioner of the State Department of Public Health and is now the Executive Director of the Cape Cod Regional Substance Abuse Prevention Initiative at Cape Cod Healthcare. Cheryl Bartlett, welcome to the show.
Thank you.
And now you're back on the Cape, but you've really been a part of this region in the area of healthcare for many years, and you've had such a distinguished career. And I wonder, for our listeners who may not know you, can you give some highlights of your career in healthcare in the region?
Sure. So I arrived on Nantucket in 1978 to be a summer nurse at the Cottage Hospital and got sand in my shoes, as we say over there, and never left and stayed 18 years at the Nantucket Cottage Hospital and think I did just about every nursing job that there was there, from the operating room, setting up a dialysis unit, visiting nurses, infection control. And then in the end, I started the Nantucket AIDS Network as part of my role at the hospital, but it grew so large as the epidemic was growing that it really required me to leave the hospital, become the first full-time paid executive director of the Nantucket AIDS Network. I then came to Community Action Committee of the Cape and Islands and spent 4 years as their executive director and really learned a lot about the linkage between social determinants and the impact on a person's health. And then I had a little segue out of healthcare and worked for the Sconset Beach Preservation Fund and tried to save houses from falling off the Sconset Bluff. And then in 2008, I had the great opportunity to go to the Massachusetts Department of Public Health, first as the director of the Bureau of Community Health and Prevention, chronic disease director for the state, and quickly rose up to become the commissioner. And I started interim commissioner in May of 2013 and then officially was appointed in June of 2013.
And, of course, you worked on so many different issues there. And when you were leaving as the state commissioner of the Department of Public Health, I'm sure there were a number of health initiatives you could have focused on then. And so I was wondering, what is it about the substance abuse problem that drove you to focus your efforts on that?
So I started my relationship working with people that had substance use disorders when I founded the Nantucket AIDS Network. Injection drug use was the number 2 reason why people got infected with HIV. And I learned back then, so for me, I think this has been a crisis for 25 years, that it's hard to find treatment. We stigmatize people that use drugs, and particularly injection drug use, and I found that people didn't really want to be that helpful for this particular population, and so trying to get treatment is a really challenge. And then throughout my career, I sort of kept circling back to this population. I ran family shelters that oftentimes people end up homeless because of their drug use, and their families finally cut ties with them. And then to the Department of Public Health, where in March of 2014, together with the governor, we declared a public health emergency around the overdose deaths, in particular from opiate use. As we knew this has been a problem for a long time, and the department had been distributing nasal Narcan for about 5 years already, but we began to see this in weekends in particular, where multiple deaths would take place in a municipality. And it felt like we really needed to call attention to this. And at the same time that was happening, a new drug was coming on the market, a new opiate that was a long-acting, extended release, had no abuse deterrent formula available for it. And so somebody could easily crush this, use it, and overdose. And we thought, we already have enough problems going on. Why do we want another drug on the market while we're trying to figure out how to deal with these drugs? And so we tried to ban it, which really caused a stir across the nation. It was a bold move. And I really appreciate the governor's allowing me to have such a focus on this issue. And so the past 9 months, my last 9 months as commissioner, I probably spent a good 30 hours a week looking into this issue, crossing the state, meeting with leaders, meeting with people who are providers in this work, and when this opportunity came up, I just thought, wow, what a perfect sort of storm of opportunity for me to come home to, and I'm a very community-oriented person, and to work on just this issue for a while would be really welcoming professionally.
And it is so interesting, as you say, you were really right in the middle of several sort of big news stories having to do with the opiate abuse epidemic over the last couple of years. Now, we on the Cape know about our epidemic problem here because we see it every day with the overdoses and the arrests. What did you learn about the issue statewide and even nationwide as you were the Commissioner of Public Health? Is it different in other parts of the state, other cities? Are there different ways people are dealing with this across the country or across the state?
So I did have the good fortune of holding 13 opiate roundtables across Massachusetts, and again heard from all different kinds of individuals and sectors about how the problem was affecting them. And honestly, the stories are really all the same. More and more kids are on the path of recreationally using a prescription opiate and then quickly turn to heroin because it was cheaper and easier to get. And so this is a really new dynamic that we're seeing in the world of substance abuse treatment. And I think that across the nation, this was an issue that all the commissioners agreed that we would work on collectively to say, what are we going to do about this really emerging epidemic? And so I think I learned that the Cape's problem is probably no greater than any other region or community in the Commonwealth or the nation, but what they are experiencing is a lot less access to resources. And that we saw both on the Cape and I saw in Western Mass. So communities that are more isolated, further away from the sort of epicenter of urban areas where the problem has been for so many years. And so community leaders in those municipalities are used to dealing with this. And I think it's really just bubbled to a surface now in the more suburban and rural areas of the state.
Now, were there any prevention methods that you saw in the course of your job, the way towns or cities were dealing with the opiate abuse epidemic that were just so unusual or so distinct that they really caught your eye as I never thought of that, of trying that method?
Well, I think what is unique and why, again, this appealed to me coming back to the Cape and particularly working for Cape Cod Healthcare is the linkage of the health system to this problem. In many ways, substance abuse has been outside the traditional healthcare system, and it created a system of its own to take care of this particular health issue. And the idea of integrating behavioral health into primary care is a conversation that has been going on for a couple years, particularly with healthcare reform, the idea that the primary care provider really takes care of all of the health needs of an individual and that this isn't a separate thing that you go somewhere else for. And so a few hospitals really have taken leadership roles across the state, and so I was very pleased to see the health system in my community stepping forward and saying that they wanted to take a leadership role, and I felt that my most recent experience and my passion to help people that are marginalized really came together as a unique opportunity.
I'm Laura Reckford, and this is Sunday Journal. I'm talking with Cheryl Bartlett about her new job as head of the Cape Cod Regional Substance Abuse Initiative. Now, that initiative is relatively new, having just started last year. Can you tell us what the initiative is and what the goals are going forward?
So while we call it an initiative, I really think it's bringing Cape Cod Healthcare to link them with the community that's trying to grapple with this issue and saying that they're willing to contribute some leadership role to really aligning people. The best way to solve substance use problems is bringing the community together. It's not one sector's issue or another. This really touches public safety, public health, healthcare, the economy. I've talked to businesses who more and more are experiencing that their workforce is either affected by a substance use disorder or have a family member that is. And when a family has someone with substance use disorder, the whole family is really part of being impacted by this issue. So this is really a multifaceted issue, and we need a lot of people at the table to solve it. And Cape Cod Healthcare had the wisdom to say that we really want to bring a public health approach to this, and that we would bring me on and to align with what the county is doing. The county's doing some great work in this area. We're fortunate to have Gosnold on Cape Cod. But how do we really come together collaboratively instead of everybody competing to do this work?
Now, I know the initiative is not just about opioid abuse, but do you think that will really be the focus?
Well, it has been right away, because we want to start doing something and try to have an impact in this particular area, but there's always an other part of the job, and I'm looking at other public health initiatives. Again, healthcare reform has talked a lot about integrating public health and population health management into a healthcare system, because you're really trying to improve the health of a whole population. And so I hope that this leads to more initiatives that address public health for other kinds of chronic diseases too.
Now, we've heard from parents who have children who are heroin addicts, and they say that one of the big problems is not enough beds for treatment. I've heard that over and over. Do you see that as part of the problem, and how do you get around that if it is?
So I have to say that kept coming up across the state as well. Not enough beds, not enough beds. And I did 20 different focus groups around the state. And sometimes when you tease out what someone means when they say that, is that there's not enough treatment options. It may not be just a bed that is needed for a person for care. Sometimes the bed isn't available because there isn't a payer source. So people will say there isn't a bed, but there isn't a bed because there's no payment for that particular bed. And so it's really a systematic problem that we need to really look at. How do we pay for treatment? Our insurance companies haven't really stepped up to pay for treatment until this year. They're going to have to. The state passed, the legislature put a bill forth where pre-authorization is no longer necessary to get substance abuse treatment for up to 14 days. Prior to that, you could be denied treatment because you didn't medically need it if you weren't in the detox phase of the treatment continuum. And so there's a lot of sort of, I think, fragmentation of the system.
Now, as children seem to get addicted younger and younger, and we now have substance abuse counselors in our middle schools on the Cape, what age do you think is the right age to start talking to children about drugs, and will that education piece be a big part of what you'll be doing?
So in the state substance abuse treatment programs, 40% of those admitted are between the ages of 13 and 29. And often by the time you get admitted into a serious treatment program, you've been using drugs for a number of years. And so, I think we're really talking about 10-year-old kids that are starting to take prescription drugs. Part of the problem is prescription drugs are legal, so they're not perceived as dangerous by kids. So if they're in a position where these pills are around and they're maybe drinking, underage drinking is correlated with the use of opiates. And so I think that we really need to get into age-appropriate discussions about health and wellness, probably with all of our children. And I think that's something that we've lost over time when we've focused our school curriculum solely on academics.
Now, Narcan has been an important tool for police and fire officials in the past few months on the Cape, and I know you were really instrumental in helping to make that happen, of having the public safety workers being even allowed to carry Narcan. And tell us a little bit about how you got involved in that and about that issue.
So when the governor declared a public health emergency, that allows the commissioner to take emergency actions and pass regulations that will impact the emergency. And so one of the first things I did, based on feedback from first responders, was that our regulations prevented them from being trained in the use of nasal naloxone, which seemed sort of an oxymoron, because communities were training bystanders how to use this medication and reverse overdoses, yet police and fire, who often are the first on the scene of an overdose, weren't allowed to do it. And so we passed an emergency regulation the same day that we declared the public health emergency that said there would be universal access to naloxone. through increased training of bystanders. We've trained over 30,000 people across the state in how to administer nasal naloxone, and now most municipalities are training their police and fire to be able to administer this. And we've had, last count I heard was close to 4,000 reversals, with about 2,000 of them being in the last year.
It's an amazing number. Now, I know some people think that this is a little bit controversial because some addicts will overdose multiple times and they're not getting the treatment they need. Is there a way to intervene somehow, maybe perhaps even a mandatory way to intervene is one idea I heard from someone involved with the issue, to break that cycle where if overdosing is not hitting bottom to the addict, that the public safety officials or the community comes in, says it's time now to start a treatment program.
I think we definitely have to add treatment to the overdose reversal, because you're not removing the addiction, you're just saving, you are saving their life, and that means we need to figure out how to get people into treatment and hopefully recovery. So a lot of thought has gone into where and when to bring an intervention after you've had an overdose reversal. Is it in the emergency room? Is it after they're discharged? I was really pleased to read about Gosnold's partnership with the Yarmouth Police Department, where they're going to do some outreach to people that have been reversed from an overdose, and so perhaps linking them with people that can talk to them about their options for addressing their problem would be a really important link. And then I would just say about the fact that people, I've heard it again and again, that people are using more because they feel now there's a safety net of Narcan. And if you talk to people that use and have been reversed with naloxone, they're usually mad that they've been reversed, because they wake up now and they have zero drug in their system, and they have a physically addictive disease. And so they're not, I think, trying to do this more and more just because they know about nasal naloxone. And it's Russian roulette. As they said, why would I risk this purposely? So, I don't know how real it is out there. I know people have overdosed multiple times, but I don't know if there's a more laxness about that.
Such a complex problem. In the last minute or so that we have, for people who have friends or family members who are struggling with this issue, what advice would you give to them?
Well, I'd say never give up hope. There's always hope to improve somebody's life and their health, and that sometimes this is a disease of recovery and relapse, and it takes multiple times that treatment. And maybe we have to think about the way we treat the addict and try to help them get to the care they want instead of judging them and criticizing them. So continue to help and hope.
And unfortunately, we're out of time. Thank you so much, Cheryl Bartlett, for being with me here today.
Thank you.
I'm Laura Reckford, and this is Sunday Journal.
This podcast is a presentation of Cape Cod Broadcasting, which is solely responsible for its content. Thank you for listening. For more information, please visit us at capecodbroadcasting.com.